All right, we're going to get started. I know we have others who will continue to join us, but first of all, let me say welcome and thank you for joining us for the first ever installment of the Summer to School virtual series. This is created by UHealth Jackson Children's Care. I'm your moderator and your host tonight, Sierra Bragan. I'm the owner and founder of Miami Moms Blog. We are proud to be Miami's premier parenting resource, and with a heart dedicated to bringing the best resources to local families. When we were approached by Jackson Health about this amazing series, we were thrilled for the opportunity to join together. We feel like these resources are so meaningful. There is a lot of information out there right now about COVID-19, about summer camp, a lot of it good information, a lot of it opinion-based. So we're thrilled tonight to be joined with two doctors who actually have research-based knowledge to share with us. So we are super excited. I want to tell you on the front end a few housekeeping things. If you have particular questions, we've fielded some questions via social media, as well as the doctors are coming with some knowledge to share with us. But if at any time you have a question, feel free to drop that in the comments and we will do our very best to address all of those. But thank you again for joining us tonight. We are so excited. And like I said, this is the first in an entire summer series. So there's more where this comes from, but make plans to join us every other Thursday night this summer. I want to take a minute and introduce you to our two special guests, as well as the experts of the evening. So help me welcome Dr. Audrey Ophir. She is the Associate Professor of Pediatrics and Director of the Pediatric Comprehensive Care Clinic at the Holtz Children's Hospital at UHealth Jackson Children's Care. So Dr. Ophir, thank you for being with us tonight.
Thank you. Good evening.
We're so glad you're here. So as a faculty member, Dr. Ophir also teaches at both the University of Miami. So she's teaching medical students as well as Jackson Health System physicians in training. So not only is she doing her work as a pediatrician, but she's training others as well. So I imagine you stay very busy, but we're thankful that you're with us tonight. In addition to just her expertise in teaching and training, she works specifically with patients who are medically complex. So medically complex children, we're talking about those with cerebral palsy, Down syndrome, Vader syndrome, autism, sickle cell anemia, leukemia, and transplant patients. So she really has a lot of knowledge to share with us, not just in general, but specifically about children who may be most at risk. So Dr. Ophir, thank you again. We're so excited and can't wait to jump in.
Thank you so much. Thank you for having me tonight.
Yes, of course. I'd also like to take a minute to introduce Dr. Brandon Chatani. So he is the Pediatric Infectious Disease Fellow at the University of Miami Health Systems Division of Pediatric Infectious Diseases. So hot topic these days. We have lots of questions for you. We're thrilled for the expertise that you bring tonight. Thank you for joining us.
Thank you.
So as a principal investigator on grant-sponsored research at the Miami Transplant Institute, Dr. Chatani also just brings research knowledge-based facts to us tonight. So we're excited to get some information with cold hard facts. Thankful for that. I know you've got a lot of leadership opportunities in the community, but also I think I've read in the antibiotic stewardship program at the Holtz Children's Hospital. So working with also the Pediatric Infectious Disease Clinical Pharmacy. So lots of expertise there. We're just thrilled to have you, and we appreciate just the knowledge that you bring with evidence-based care. So thank you for joining us tonight.
Of course.
Awesome. Well, like I said, if you're just joining us, we're thrilled to have you for the Summer to School virtual series. Tonight, we're going to focus specifically on the topics of COVID-19 in children, related to our summer activities, our summer travel, and then we're also going to spend some time at the end talking about the MIS-C syndrome, which is the inflammatory syndrome associated with children who have had COVID. This is kind of what we're noticing that's popping up. And so we're going to dive more into that, get some facts there. But like I said, if you have a question at any time, I'm going to do my best. If you see me looking away, it's because I'm checking in the questions, but drop those in the chat and we'll do our best to get to them. But let's get started. Doctors, I would love to start on the topic of COVID and summer camp, because as a mom of two, we've been in quarantine for a long time, and I'm thinking, is it okay? Is it safe to send my kids to summer camp? I'm hesitant. Maybe moms out there are worried about them being exposed to COVID-19. As a pediatrician, do you recommend summer camp?
Well, I think that this is a really important question because as this COVID-19 crisis is prolonging itself, parents are faced with really important questions for their children, and sending their child to a summer camp is definitely a big one. I think that with any decision making, it is worthwhile to weigh the benefits against the risks. We do know that summer camp experience brings a lot of positive effects to children. It teaches them new skills. It makes them more independent. It teaches them leadership skills. And it creates bonds with other children, usually the same age. So overall, yes, summer camp experience is beneficial to children. The only problem is this year, because of COVID-19, it has to be done wisely and it has to be done safely.
That's right. That's right. Dr. Chitani, is there anything you would add to that?
No, I just echo that this is a very important thing to consider, and that doing it wisely and safely is what we're going to discuss, how best we can all do that.
Well, that's great. Definitely, like you mentioned, there are benefits to summer camp. We kind of immediately go to, the risks. So I love that you brought up the benefits of our children having those memorable experiences, the opportunities for socialization, all of those things. But yes, we need to also talk about the risks. So let's talk about that. Tell me, would you say that there's maybe a preference, or would you say like indoor versus outdoor sort of camps, maybe a sports camp versus something that might be more indoors? Is there really maybe a better choice?
Of course. So there hasn't been really any national guidelines as to how summer camps should reopen, but certainly the CDC has put out kind of a gauging scale for summer camps to be considered low risk versus high risk. And there's certain parameters that parents should look at. So first of all, is the summer camp going to have and enroll large group of children or smaller group of children? Because the smaller group is definitely the safest way to go. The second thing is outdoor activities definitely are safer. So it is important to check on that. The third thing also is, are they going to be able to have social distancing during the camp activities? And the other thing is, are they going to have any kind of sharing during the activities? So outdoor versus indoor, outdoor is definitely safer, but also how big of a camp, how big of a group of children, and also are they coming from the same geographical area? Because it does make a difference for COVID-19. And if they come from the same, it is safer. Are they going to be staying within the same group continuously and constantly throughout the summer camp? And the same thing for the counselor. So if you're going to keep the same group of children, the same group of counselor coming from the same neighborhood or geographical area throughout, and it's a smaller group, social distancing, then it's certainly with outdoor activities, this is something that is preferable.
That's good. Yeah, I didn't think about it in those terms. Like, okay, sending my kid off to maybe a sleepaway camp where there's a lot of kids from all over versus, a camp here in Miami where maybe the enrollment is smaller. Even if it were, say, indoor, there is less risk that way. So there's definitely things to consider there. That's good. What would you say? We have a summer camp guide on our website, which a lot of moms are, reaching out saying, what are great camps? Have you checked these out? Do they have safety precautions? And we speak with our partners about this. But as we're looking out camps, like moms and dads out there, what is like the minimum baseline safety protocols you think people should be having, like these camps should be having?
That's a great question. So I think that there are definitely some number of measures that they need to verify that the camp that they're looking at is going to be safe for their child. So we talked about the groups, the size of the group. So again, you want to go ahead, or you prefer that the size of the group is going to be small. preferably again from the same geographical area, and preferably that this group is going to be constant throughout the length of the summer. So that's the number one. The second is you want to go ahead again and ask what kind of activities are you going to have. Outdoor activities are preferred rather than indoor. Are they going to be sharing any object during the activities? You want to find that out because you prefer no sharing of object. The other thing that you want to ask the camp ahead of time is also mealtime. How are they going to deal with lunch, for example? Obviously, you cannot wear a mask during lunch, so outdoor would be preferred, and also no sharing of utensils or anything like that, and social distancing during meals would be preferred. Are they going to have measures of sanitizing the surface, the contact surfaces? So tables, chairs, ramps, doorknobs on a regular basis, and preferably, of course, after each activity, is something that a parent would want to check ahead of time with the camp. Sanitizing stations, for example, with sanitizer, and also hopefully asking the kids or reminding the kids to wash their hands throughout the days. So you want to make sure that they're going to have those stations throughout the campsites. That's something that you would want the parent to ask ahead of time. And then the question that maybe they might not think of asking is, does the camp have a plan of action if somebody gets sick? So whether a counselor or a child has a fever, diarrhea, a cough in the middle of the day, do they have a protocol for that? And ideally, they should have a designated person to be able to act on, to isolate the sick person right away, to be able to evaluate that person. If it is a camper, to contact the parent right away. So you want to make sure that there is a protocol in place and a plan of action.
That's great. That is a question you don't think to ask until something happens. So that's a great one to be on the forefront thinking of. Wonderful. I love that. Talk to me about, obviously, well, moms and dads who are listening, I failed to mention this on the beginning. One of the things I love about this conversation that we're having with Dr. Ophir and Dr. Chitani is that they aren't just medical professionals. They both have children. So coming in as parents, they have a lot of the same questions, concerns, and I know that in treating their patients, they would treat them the way they would treat their children.
Absolutely.
So I appreciate that you come with that perspective, because as a mom, you're speaking to me not just as a medical professional, but as a mother, which means a lot. So your word carries weight in that, and Dr. Chitani as well.
I always tell my parents I would do to their children what I would do to my own children, with a little caveat that Dr. Chitani is a lot younger than me, so I'm a grandmother. So I would definitely think about all these things for my granddaughter, definitely.
Right.
But I definitely feel for all those parents of little kids. I have young children, and you have to consider of whether or not they're going to tolerate a mask or not. And so that's definitely something I'm here to talk about and to let everybody know what can we do.
Yeah, that's great. That's great. Dr. Chitani, question about this, a little follow-up to Dr. Ophir's question. Say we, send our kid to camp, and then we do hear that someone gets sick. Maybe it's not confirmed COVID, but it's not sure, or you're awaiting the test results. Would you pull your child out of camp like immediately? Would you kind of wait it out? What would you do in that scenario?
That's a good question. It really depends on the situation and what the parents' comfort is with what the follow-up protocol is after the camp has identified that person. The testing that should occur, that should be a part of their protocol, should be pretty rapid, where you hear 24, 48 hours later, a day or two later, you should know whether or not there has been a COVID risk in that camp. And then that spurs a whole nother set of questions of what you might do. But for that particular question, at least you'll know, okay, no, this was just your common cold kind of stuff, your common diarrheal type of illness, and then you can feel a little bit safer. They'll go back, but still be aware that they could still get that illness. There's other illnesses kids are still going to get throughout the summer.
Yeah, that's good. Talk to me, we just received a question that I'd love to address. So let's talk a little bit about maybe children who already are maybe immunocompromised. For example, one mom shares that she has twins who are blind, autistic, and epileptic. So a little bit, different, maybe not necessarily their respiratory immune, but would they be at extra risk if for COVID at something like a camp?
So I'll start, and maybe Dr. Chatani wants to chime in, but I think that children with special healthcare needs, it's not so much that they are at a higher risk to get the infection, because statistically they're not, but the problem is if they do get the COVID-19 infection, they are certainly more at risk to get sicker than the other children. And that's where the problem is. They're just more fragile. And so the problem is, because of that, you want to be more protective of them. And so you definitely want to be more careful about, you might want to shelter them in more. You want to go ahead and see, you know, if it's somebody with a defense system, an immune system that is down, you want to be a lot more careful with whom they're going to be in contact with social distancing, where they're going, around whom they're going to be. So a camp activity for somebody with a lower immune system is a big, big dilemma right now. I would be very, very hesitant to do that because of the complication of a COVID-19 infection in such an individual. Yes.
Yeah, it's a great discussion to have with your pediatrician. Because every child is different. Every child has different circumstances surrounding their illness. If they have a chronic illness, it's a great discussion to have with your pediatrician of where they feel your risk is. If they feel that you need to be referred to another specialist to assess that risk, there's a lot of support around these children because we know they're the most vulnerable.
Yeah, no, that's good. One mom asked about symptoms in children. We're going to get a little more into COVID in just a minute. So we're going to table that one for just a second while we continue to talk about camp. One mom asked, you mentioned that your parents, are you sending your children to camp? I have to say, my children were enrolled in camp, but their camp was canceled. So at this moment, we are not going to camp simply because we haven't decided on an option yet. So I'll say that.
So for camp, if our kids are going to camp,
Yeah.
So I have a 4-year-old and an 8-year-old. The 4-year-old is not going to camp right now. We hadn't thought of her going to camp right now. But our 8-year-old was enrolled in a Taekwondo camp that was canceled. It was initially canceled at the same time and it was made virtual. Right now they have a hybrid option where you can do some virtual. And then if parents would like to, they can enroll in the contact. I was concerned about the contact that was there and that not enough safety was included. And so we opted for to stick with the virtual for now. If we find another alternative or they change their protocols, then certainly we would enroll them as well.
Great. Dr. Ophir, you have adult children, so I assume they're not attending camp this summer.
No, and my granddaughter is very little. She's only 2 years old, and she's had virtual schooling right now.
Awesome, awesome. I want to transition a little bit. So what would you suggest we do about, obviously camps have, hopefully if your child is attending camp, they have great protocols, they're using safety measures. What about playgrounds, parks where things are being touched and used, and maybe we don't know who was there before us? What do you suggest about visiting these sort of places?
So park and playground, that's a really great question. The playground itself poses a huge issue because it has surface contact. You have a lot of traffic. And let's face it, you're not going to be able to either have control or knowledge about the people who have been there or the children who have been there, and you're not going to be able to sanitize the surface before and after. So the playgrounds right now, and I can let Dr. Chetani confirm or not after me, but I would say playground would be a no for right now. Now, going out to a park that does not have the little playground, certainly it's an outdoor activity as long as you have social distancing, sure. But the playground, I would say probably no for right now.
Right.
I agree. I think it's a great opportunity to take your kids out, go on a walk in a nature trail or a park, talk about nature. They can learn ABCs and say, what does L start with? All those wonderful activities you can do with your children. It just doesn't need to necessarily involve a slide, a swing. Those contact surfaces are still of risk at this time.
That's right. I love it. Moms and dads out there, we're going to get extra creative when we go
Yes.
on outdoor adventures now. We can't put all our hope and stock in the slides anymore. We got to get creative. On that note, okay, what about the pool and the beach, as well as like zoos, museums? You know, there's several different levels of kind of outdoor activities.
I'll start with the beach, and then I'll let Dr. Chatani chime in. So the beach is considered a lower risk activity just because it's an outdoor activity. But you have to make sure that there's certain factors in. So if it is not a crowded beach and you can be sure that there's going to be social distancing, you have to talk to your child before you go out to the beach. Make sure that they understand that they need to stay next to you, that it is important that there's a distance. You need to leave prepared, have your mask before you leave. And if it starts to get crowded, as far as I'm concerned, that's your cue to leave. So the beach, relative to other activities, is, as long as it's not crowded, is considered a lower risk. The community pool, the condo pool, I would say not so. It is a higher risk because there's a lot of traffic, a lot of surface area that are in contact that you're not sure whether it's contaminated. The chairs, the tables, there's traffic, you don't know who has been in contact. And then, you know, as far as the other areas of activities, I don't know if Dr. Chatani, you want to go ahead and take over for those, but I think you mentioned the, what were the other activities? I'm sorry.
Like zoos or museums.
Other locations. That's a great question. And really with you'll hear us say this kind of over, the theme will be the same throughout tonight, that it's really about looking into and researching where you're going. If you're going to a place that is instituting good protocols and has given thought and shows that they're giving thought to how to keep everybody safe, you're probably going to be in a safer situation. So a good example for a zoo is I've seen zoos have protocols where you only go along a certain path. Everybody goes in the same direction, and they only limit how many people can go in at a certain time. There's good hand sanitizer that should be available, although you should bring your own just in case. And you keep your distance. So we're talking about social distancing. That 6-foot rule still applies. Even with America reopening, the 6-foot rule still applies. You keep your children close and safe and keep your distance. You still get to see all the cute animals.
That's right. Hey, that's good. I was excited to hear that the zoo is open, so we can do that safely if we follow the rules, mamas.
And if I may add regarding the pool, I forgot to mention, it is important to keep the mask dry. If it gets wet, it is difficult to breathe through, so you have to keep that in mind. I know that parents have a lot of questions about pool. You know, even if the pool is empty, you have to think about a lot of unknowns. You know, are the ramps sanitized, for example? You know, so you can't really know for sure. So in a gradient of what is safe or safer or riskier, we're not saying that it is very risky, but certainly it is riskier than the beach, just because it has more contact surface area. That's the problem.
Right. And if you're using your own towel, or if you're using the towels that are provided at the community pool, there's risk there too, right? You don't know how they sanitize those towels necessarily. Whereas if you bring your own towels, certainly that could be safer. So you just have to be aware of your surroundings and what you're using. Same with the beach. I know there are some provided communal chairs that could be there. And I personally wouldn't necessarily recommend using those because you could have that contact surface that you don't know if it's been appropriately sanitized or not.
Great, great. You know, it's a little bit like what we said with summer camp. You kind of have to weigh those risks and rewards. So if we had to put it on a little linear graph, parents, let's say, do the nature walk, maybe start in your neighborhood, then maybe go to the beach if you feel comfortable with that. Perhaps the zoo if you're practicing social distancing and all those measures, and then maybe the pool, the community pool as the last kind of option. I want to move on because we have so many good things to cover tonight. Transitioning now to PPE in children. So as parents, we know that wearing a mask ourselves is a challenge. Much less with a child or even a child with special needs. So talk to us about mask wearing with children. How can we promote mask wearing in a safe and healthy way?
So I'll take that one. So I think that it's like any new behavior with children. You want to go ahead and prepare practice, and reward. So how to prepare, you want to go ahead and talk to them, explain to them at their age level with their own words why it is important for them to wear the mask, to protect themselves, to protect others, and then engage them in that preparation. So you want to go ahead and maybe do little drawings or little coloring of the mask. You might want to go ahead and put the mask on their stuffed animals or the doll, role play. They might become the superhero mask, you know, that kind of thing. You want a role model too. So you want to wear the mask at home. You start at home first with a minimal amount of time, you know, 5 minutes at a time. You don't want to go ahead and take them outside for prolonged time right away. So you go ahead and practice. So practice and practice at home for longer periods of time, and then you reward. So when they do put the mask on, then you go ahead and either stickers or some kind of privilege play. You go ahead and prepare, practice, and reward. So that's usually what pediatricians recommend for a change or a new behavior.
I wrote that down because I think that applies to a lot of areas of parenting. Prepare, practice, reward. That's good. I'm going to remember that. Dr. Ophir, I'd like you to add one thing if you would. I know some of your specialty is working with, you know, children who have autism. How would you encourage a mom? We received a question just who her son, you know, has sensory issues. He's nonverbal. How would you kind of encourage her to practice, prepare, and reward to get him to use that mask?
So that's a very good question, because that's going to be very, very difficult. And I think that for these children, not only to wear the mask, but to wear the mask for a lengthy period of time is going to be very, very difficult. And these children with special needs, I would say you have to really think carefully about where you want them to go, where you want to go with them. So in those cases, social distancing, outdoor activities, I think that it's almost mission impossible for them to be able to wear that mask and to wear that mask for long enough to be able to stay safe. I think it's going to be asking a lot. Obviously, if they are in therapy, behavioral therapy, you can work with their therapist to see if that can be achieved. But I think it is a very, very difficult thing. So you have to keep that in mind.
Oh, that's good. Thank you. Thank you for that. I know, you know, we all have different scenarios and every child is different. So I appreciate you addressing that. If you're just joining us, we're talking through summer camp and COVID. We're going to start transitioning to summer travel. And then we're going to talk a little bit specifically more about COVID in children and like our day-to-day activities. So let's segue a little bit to summer travel. Now, say your family really wants to go on vacation this summer. Would you recommend that travel is safe?
So it really depends on, you know, where you're going, how you're traveling, what mode of travel that you're using, and going through this kind of checklist that we've been talking about. How are you able to appropriately keep social distancing? Depending on the age of your child and condition, are you able to have them in a mask? We heard today good research talking about masks. And I know there's probably tons of questions about which mask to use and can you do homemade masks? There's a lot of data actually out there. And it talks about that a mask, someone who has COVID and is wearing a mask, that reduces their risk of transmitting by 90%, which is amazing, right? And depending on the material of the mask, you can really augment that even more. For children who aren't expressing as much virus and transmitting as much virus as, say, an adult, by them wearing a mask, they reduce their risk of getting the disease by 30%. So not huge, but still something more to, when you couple that with social distancing and everything, you really drive down those numbers. We know that in Florida, the numbers of COVID have been, in children is much less than adults, with more recent values of where there's like 3% of children that have actually experienced this, and even fewer that actually required any kind of hospitalization.
That's in Florida, those statistics.
That's in Florida specifically, and that there are no children currently reported, as per Dr. Rifkes, our state surgeon general. There are no children reported to have died from COVID, which is fantastic in Florida. Awesome. And that really goes out to all of our parents doing their due diligence, all of our frontline workers doing their due diligence and keeping our kids safe.
That's awesome.
So really think through your summer plans of where you want to travel, look up on the CDC website, see if that spot that you're going to is a hot spot. Remember, there are still some places in the nation that are experiencing a lot of cases. And so you want to be careful of where you're going. Certainly international travel is still pretty iffy if you want to consider that.
Right.
And then otherwise, wearing a mask, good hand hygiene, and keeping social distancing will be key.
That's good. Would you say it's safe to like rent a car or fly on an airplane just with precautions?
Yes, I mean, certainly renting a car, you're there with your family, and I've heard some car rental agencies really touting that they're going the extra mile to sanitize the car between people's uses. And then of course you yourself can, have a wipe there and wipe down surfaces and go from there. Certainly air travel, they have their own protocols in place. Obviously, when you're in an airplane, you have recirculated air and there is less, space to do social distancing. So you have to consider that risk as well. And it's just that risk benefit and balancing it out, talking it out with your family of whether or not you want to go that mile and do that.
And if I may add, the problem with the car ride is not so much in the car, as Dr. Chetani mentioned. I mean, they're really trying hard. It's going to be the stops. When you're going to be stopping along the way, that's where you're going to be meeting areas with high traffic. If you have to go to the restroom in the middle, those that's where the problem is going to be. So you have to kind of weigh the pros and the cons. One of my daughter had to travel and she was looking at different modes. And just as Dr. Chetani mentioned, there's 4 parameters that you always kind of want to gauge to be able to evaluate the risk of an activity. You want to go ahead and figure out, not so much for the mode of transportation, outdoor, indoor, but how many people are going to be around you? So social distancing, as Dr. Chetani mentioned, before, but also, how long you're going to be in there. So for the plane ride, it does make a difference. Is this going to be a 2 to 3 hour ride? Whether you're going to be a north or if you're going to be an 8-hour, 10-hour ride, it's going to make a huge difference. And sometimes if it's a short flight, but you have to consider at the airport, then you're going to be at the airport, make sure that you're going to have social distancing, wearing the mask for the children, washing your hands and all of that. So I think it's just a matter of kind of looking at the whole experience and gauging the pros and the cons.
Right. That's good. That's good. The principle I think that we can walk away with tonight, regardless, when we as parents are standing there going, do I send my kid to summer camp? Do I go to the beach? Do we go to, Georgia and take a trip? Do we go to Spain? It's stopping. And we really all, with the information that you've shared just already, we still have 30 minutes left of information you're going to share with us. But what we have already, understanding like good protocols, good, keeping our hands clean, wearing those masks, all of that, we really have the knowledge that we need to do that, like you said, risk benefit analysis to decide. So thank you. That's so good. Okay, talk to me about, say we're going hotel versus Airbnb. Would you suggest one or the other?
I mean, it really depends on what kind of Airbnb you're talking about, and because you don't know who's been in there prior. And you have to have a conversation with the host. Like usually with an Airbnb, you get to connect with the host, then you can ask the questions of how it's been sanitized, when was the last person there, those kind of questions. Mm-hmm. Hotel, they are more public with their, like what their protocols are and what they're doing. You just have to go through it and see. You really want to see that space surfaces have been cleaned, that, if people are wearing masks in lobby areas, that's being done if that's the case.
I think these are really tough questions to answer because it's really up to the families. And again, any decision, you have to weigh the pros and the cons, the risk and the benefits, so how badly do we want to go there, take the hotel or an Airbnb, but take the risk of, is really what you have to consider, because we still don't know everything or even a lot about this COVID-19. So again, just as Dr. Chetani mentioned, you have to do your homework. You have to do your research about the place that you are envisioning to go on vacation, but you really have to put in the balance. Is this worth the risk? Because there's always going to be some risk.
Right.
Yeah. One more question on this topic and then we'll transition. But what if you decide vacation is for us and you're traveling, but you begin to feel sick? What's your suggestion if you're away from home and you're feeling sick?
Definitely a good question. I mean, even before the pandemic, it was always a recommendation from pediatricians that if you're going on a vacation or a trip that you have, an emergency plan, that you have a plan that where you're going to go or how you're going to seek medical care if it's needed. If you're feeling sick, so if we're talking about the adult feeling sick, you definitely, it's a judgment call of how bad you feel and whether you want to go get tested or seek medical advice. Since I don't deal with adults, I would seek your doctor's opinion about your personal condition. For kids, if your kid isn't feeling well, obviously we want to be super, super careful in this current situation and environment. So if, children with fever, children with abdominal pain, it's of greater concern, especially if you think that there has been an exposure. And in those instances, you have to see where you are in travel, of whether or not you seek right away, whether or not you quarantine, and then seek medical attention afterwards. It really just depends on where you're at. But seeking medical care sooner rather than later for children is a bottom line. I know with the pandemic, a lot of people were talking about, stay away, stay home. That was the case. But what we're seeing more for the recommendations for children, that if you think this could be a COVID-related disease that you're seeking medical care sooner rather than later is important.
Don't just try to ride out these symptoms. Could you speak a little more specifically to what would be symptoms that we need to watch for in our children if they have, if we're worried or uncertain if they've been exposed to COVID-19?
Yeah, and it's a troubling thing, both for physicians and for parents trying to identify, because a lot of the illness that you see initially is very similar to other viruses that we're going to see throughout the summer, and then as we go into the fall as well. Key though is the fever, and seeing fever that kind of rides out beyond the 24, 48 hours, 1 to 2 days. You're seeing high-grade fevers. Children less than 10 years old are more likely to have respiratory, so runny nose, cough, cold kind of symptoms. And so you're kind of looking at those symptoms and seeing how well they're feeling. And then the other things are just tried and true, no matter what the illness is. If they're not eating well, if they're not drinking well, then they can become dehydrated. So all of those things have to go into account of whether or not you're seeking medical attention. In this day and age of virtual medical care, there's great access out there. Seek it. There's a lot of insurance agencies that actually offer a nurse 24/7 for you to call and just bounce what's going on. So look at your insurance plan, have a plan in place, and travel safely as much as you can.
Right. I think that's an excellent point. I was going to add, actually, if anything, with this COVID-19 crisis, the telehealth services have expanded so much that for all you know, wherever you're going to be, you can always contact your pediatrician's office. And then they might offer actually a telehealth session. And this way you get it within what we call the medical home, within somebody who knows your child,
Right.
to be able to evaluate your child through a telehealth session. Now, of course, if there are worrisome symptoms, and your child is in respiratory distress, is struggling to breathe, then absolutely go to the nearest emergency room, absolutely. But if it's something that can wait, you might want to just get in touch with your regular pediatrician and they might offer you telehealth. And this way it's somebody who knows already your child.
That's a great point. And, there's a lot of craziness in this time, but a lot of things to be thankful for as well. And I'm like, I think telehealth is here to stay, and I'm glad because as a mom, sometimes it's a benefit to be able to just call in or video in. So that's great advice to start there, regardless of whether we're traveling or we're at home. Okay, I want to segue to COVID and activities. We've received a few more questions about you know, particular activities. So things like, you know, dance classes. And I know we spoke a little bit in general about this. So if you've just joined us, you know, again, it's weighing what are the protocols, what are the size of the class and whatnot. But how many people would you say is too many people to have, like let's say a gathering in your home? What
Right.
would be your recommendation?
So right now, CDC has released some numbers that people within a confined space, really 10 people is where they're averaging. And really, it just depends on the space, right? If we're talking about a small closet of a room, 10 people might not even fit in the small closet of a room. So you want to be able to have 6 feet between you and the person next to you. Even when you're sitting around at a table, if it's new people to your household, you know, having that 6 feet is what's going to be key. So going out to a dance studio, I mean, I wouldn't necessarily recommend tango or something that you're there and touching people with. But maybe if it's separated and has that
Individual dancing, right?
yeah, right. Each individual dancing, that's great. But also just to tout, like there's a lot of virtual options that are currently being made available. So I know my kids dance in my house all the time, and there's dance lessons that are available that way too. So, you know, look out your options and see what can be done safely.
That's right. Okay, what about public entertainment venues? We spoke about museums, but what about things like bowling or the movie theater or, you know, more kind of gathering spaces, entertainment spaces that we're used to?
Right. So some of the spaces I would say no. I mean, you think about a bowling
Bowling can
alley.
wait, everybody.
Yeah. Sorry.
Bowling can wait
No,
for sure.
okay.
I think we were all kind of eked out by it to start with. You're sharing someone's shoes and touching other surfaces that other people just touched, and now you're thinking about pandemic. No, that's probably a no for me.
Yeah, definitely a no. Definitely a no. Yeah, I'll have to wait. Any of those will have to wait.
Movie theaters, I haven't heard too much about if movie theaters are trying to making people sit
I
distance
don't, yeah, I
apart.
don't think I would.
Yeah,
Yeah.
but it's still a common surface, and I don't think they're wiping down the entire movie theater every time people are coming in and out. So probably something that
Unless
you
you're
can
coming
watch.
with your own Lysol can, probably not a good idea.
The idea is if you have a safer choice and you can do it from home,
Netflix.
the pros and cons.
That's right. No, you know, and a lot of these, I want to answer everyone's specific question, but if we can't get to everything, I think it's just a lot of it falls into this risk reward.
Yeah.
And we know the baseline for safety measures and protocols. Let's talk a little bit when we were talking about masks. I didn't get into this, but what about face shields? I had like a mom ask, what about a one-on-one swim lesson if the instructor's wearing a face shield? Like there's obviously contact happening. They're in the water. Like, can COVID be transmitted via the water, or is it just, you know, respiratory airborne?
It's just respiratory airborne. Sorry, this virus is encapsulated in large droplets, and those droplets stay in the air for a moment and then eventually fall to the ground. So if you're thinking of like water being there and short distance between your mouth or nose and the water, it's going directly there. Certainly a face shield on an adult that's being like very close, up close to a child could be a good recommendation to follow. As far as a face shield, a child wearing a face shield, that might be a little excessive. I don't think there are many children that would tolerate that necessarily.
Right. Yeah.
Dr. Fear, did you have something you wanted to
No,
add?
I was just going to say, I think it's one of those situation case by case, because I think that we're talking probably about a one-on-one lesson or a teaching, swimming teaching lesson, right? And I think it really all depends. And again, here the parent has to do their homework and find out, well, what kind of behavior did this teacher have, you know, during the COVID crisis? Where they're wearing masks, you know, where they're respecting social distancing? Have they had any contact with COVID positive people? Because the face shield in itself is not going to guarantee, you know, everything, and is not going to offer 100% protection. So I think it's important to still have that conversation. I think that would be my advice.
That's good. Yeah, that's great. A good thing to remember that it's not just about what everybody's doing right now today.
Right.
But it's where have you been and what have you, because that's,
Right.
yeah, all the hard work we've been doing these last several months, you know,
Right.
making sure that we're associating with those who've done that same hard work. That's good. Okay, a little more segue again. But before I do, we talked about PPE, we talked about masks, we talked about shields. Let's talk about gloves. So there's a lot of misunderstanding, I think, about gloves. Do we wear gloves? Do we need gloves? You know, if we're wearing them for an extended amount of time, is that a bad idea? Just talk to us about glove wearing and the necessity of gloves.
I think in children, first of all, I don't think that the CDC has been recommending gloves for children. But even in the adults, I think that it gives a full sense of security, and that's where the problem is. I think that we kind of have a tendency to think, oh, you know, I'm wearing gloves, and we don't realize that once the glove is contaminated, we may be, for example, touching without realizing, touching our face, and right there we're contaminating our face. So it is recommended really better not to wear the gloves and just keep on washing our hands rather than wearing gloves and getting ourselves into risky situation.
Yeah.
Agreed. Absolutely agreed. I would just add, related but not exactly to gloves, that we talked about face masks, and yes, they're very important, and we want to make sure two things. One, we mentioned that they're not wet and they're not compromised in that way. Two, that they're worn the right way. A mask that's worn underneath the nose is not effective, and that 90% that I was talking about doesn't work.
Doesn't apply there.
Over the nose, right? It has to be covered with a pretty decent seal to give you the full benefit of what it can offer. And still to this day, the state surgeon general and everybody are really promoting that a face mask is key. Social distancing and face masks are key to keeping this under control in children.
And I guess while we're on the topic of face mask, remember that children less than 2 years old should not be wearing a mask. They would not be able to breathe well with them. And then the second exception to wearing a mask are anybody with an underlying condition that would make it difficult for them to breathe through a mask. That's the exception to the rule of wearing a mask as well. So no children under 2 and nobody with some kind of condition that would make it harder for them to breathe with a mask.
That's right. The goal is breathing, people. We want to be able to breathe. That's great. No, and I've seen too people, you know, go to great pains to wear the mask, but then they're like this when they're taking it off. Like, isn't there a proper way to not contaminate our masks? Is that correct? I mean, it matters, right?
It does matter. But even if you touch the face of the mask, if you wash your hands immediately after, then you've decontaminated yourself. Just know that, yes, COVID sticks to the outside of the mask. That's the purpose of the mask, is to stop it from going into your airway. So if you touch that surface, you put it somewhere. I personally get my mask that I have to reuse at home, or if I'm going out, not in the hospital, I put it in a Ziploc bag. And so I touch it at that moment. I put it in a Ziploc bag. I wash my hands, and I know that mask is now safe for me to reuse later. And I am no longer contaminated, so I'm able to go about my day.
That's good. That's a good tip. Mine's been floating around the bottom of my purse, so I don't know what's more dangerous, my purse or the outside world, but that's a good tip. And honestly, I hadn't thought about, in my mind, when I'm touching the mask, I'm putting germs on the mask, but in reality, I could be getting germs on my hands from the mask. So I wasn't thinking of it the inverse way. So you've given us something to think about. Okay, hang with us, everyone. We've got a few more minutes. We're going to zoom through a couple more questions, and then we're going to close out with some questions about the MIS-C inflammatory syndrome, because we, as parents, have nervous fears and questions about this. But before we do, talk to me. Another thing that parents, I believe, have fear about is, okay, going into a hospital, or say going into a clinic where my child, you know, did OT beforehand. Now, you know, we're doing telehealth, but is it safe to go in? Like, what's your recommendation? Because like vaccines and routine checkups, would you encourage people to pause those right now or to carry on?
I think that is an excellent question. I think that all providers have gone at great length to make the environment and their clinics or their sites really a safe environment for their patients. Pediatricians have always been caring providers, and we want our patients to be able to be seen and to be able to be seen safely. The problem is right now we really don't want to end up with some other kind of crisis and epidemic in the middle of this pandemic. So it is so very important to not only keep your children updated in their vaccination, to come call your pediatrician, make that appointment, but also for their well child care visit. It is extremely important to be able to stay updated on that. So to answer more directly the question, I think that really all the providers have really paid a lot of attention during this COVID-19 crisis to be able to make their practice very safe. I know that here in our clinic, we are not letting anybody wait in the waiting room. We are putting them through into the room, the examination room. The private practices have morning well, afternoon sick. They have separate waiting rooms. So everybody is going at very great lengths to be able to make it a safe space for their patients. So it's very important that parents understand that this is the time to be able to make that call, to make that appointment, catch up on the vaccine, catch up on the well child visit. Very important.
Yeah, I agree with everything and fully support. We should make sure that our vaccines are up to date and not create another crisis within this crisis.
That's right. That's right. Keep our children updated on all those
Yes.
vaccines and checkups. Awesome. Okay, I want to segue now to a discussion about Miss C. So, Dr. Chitani, kick us off because I know this is something you're excited to share about because you have expertise here. So, talk to us about what is it? I mean, we've heard on the news Kawasaki. What is this? We just hear as parents, we're watching the news. We hear this terrifying thing happening in children. Help ease our nerves. Talk to us about it.
Yes, so we'll start with just the numbers that we currently know. We know that there have only been 9 cases in the entirety of Florida in children that has been reported. I know down in South Florida, we have 2 of the 9 that we've reported. What is this disease? So we know that this is a post-viral immune response. I know that's a big word, but it really means that after being exposed or having the virus, either can occur, our bodies produce a defense against it. It tries and fights it. That fight against the disease gets a little bit out of whack in some kids, not all. In a very small portion of children that are exposed or have the virus, their immune system goes out of whack. And I liken it to, normally how the immune system should respond is summer traffic in Miami. If all of you have been in Miami, right? And right now, traffic's pretty nice. I enjoy my commute. It's not too bad. I can change lanes and get to where I need to go. Then you have come September when school starts back and traffic's all kinds of crazy. People are going in all kinds of directions and there are people angry and inflamed, and that's exactly how you can think of what Miss C is. It's when their immune system goes a little haywire and it starts attacking some of the other organs of the body. And so we've seen kids that have heart disease, liver disease, even some of them affecting their brains. And so it really can be a serious thing, and we are taking it very seriously. In that the hospital has devised protocols to diagnose it early and to make sure we don't miss anybody that comes through. That being said, it's rare because I told you only 9 out of all of Florida, but it can be very serious. The reports from New York had over 45 kids that they had this disease. And granted, they had a much wider swath of viral infections in adults, and we know that that's being translated into children, the exposure in children. Right. And they only had 3 of the 45 die from the MISC, the multi-inflammatory syndrome in children. So still, it can be present as very serious, but not all of them end in death. To not, kind of ease maybe a little bit the scare about like, will this kill my child?
Not a death sentence, right?
Not a death sentence, and especially if medical care is sought early and management is started early. They're giving the medications that are necessary to prevent the disease from progressing much further.
Correct. I have a clarifying question about that. I was under the assumption that a child has to first have had COVID-19 and then they could get this, but I hear you saying they could be exposed to it. So does that mean maybe mom or dad had COVID, the child was just exposed in that way, but necessarily didn't have it, but they could still get like Miss C? Is that true?
Yes. So when we've done tracing of, okay, a kid comes in with MIS-C, did they get COVID when we do the test, or do they have COVID right now? Who may have exposed to them? We see that there typically was an adult who had COVID about 28 days before the start of the MIS-C. So we know there's this time lag, which makes sense. As a physician, it makes sense because we know that it takes some time after your body's exposed to an infection that it starts producing this immune response.
Okay.
So yes, it can be either exposure
Okay.
or that they actually have the disease. And what you'll hear and what you'll read about is either they tested by PCR, it's a specific test that says, yes, the virus is there, or they have the antibody, that's the immune response, it has started. So it means in the past, they were exposed.
Okay. All right. 2 cases in South Florida is too many in my mind, but at the same time, those numbers are comforting to say that's a very, very rare and small percentage. So that does put us at ease. But again, we wish that number was 0, of course. Talk to us a little bit more about just the symptoms, because maybe we, like you said, maybe our child was exposed to COVID. We have no idea. That kind of came and went and never knew it. But now we're seeing symptoms of what could be this, MIS-C.
Right. So we know from the New York experience, South Wales, Denmark, a lot of publications have gone into this that have identified that 2 things, fever and abdominal pain. These 2 are one of the 2 top symptoms that children are presenting with.
Okay.
We also know that it's typically some younger kids that are presenting. Less than 10 years old is the current number that we're hearing about as being those that are likely to present. The teenagers present very differently, and actually the teenagers are more likely to present to you with an actual COVID disease rather than the post-viral, the after COVID exposure disease that we're talking about now, which is MIS-C. So those 2 symptoms are things to look out for. And the CDC says 24 hours of fever. I'll tell you that most doctors are really looking for the 2 days or 3 days of fever as being that red flag. Hey, I need to start testing and seeing if something is going on. Okay.
That's good. Okay, that puts us at ease. It's amazing the things you hear in media, but to sit down with an expert, a pediatrician and a pediatric infectious disease expert, this is helpful. So moms, I mean, even just there, I've learned, okay, the main symptoms to watch for is that fever and that abdominal pain, and then thinking, okay, children maybe 10 and under, which doesn't mean the older children aren't susceptible, but maybe it manifests in different ways. That's helpful. So as a mama, I know other parents watching, should we be worried about our children contracting this?
So, I mean, like I said, it's very rare. And I think that the worry shouldn't be so much that it's going to happen to everybody and every child that ever has been exposed, but equally, being vigilant and saying, this could be something that is something serious, and doctors are taking it seriously. So looking out for those signs and symptoms is what is going to be important.
Great. Oh, that's really helpful. Thank you. And then I assume, as you've directed us with other things, especially with the COVID-19 symptoms in children, if we feel like our child is exhibiting these symptoms, immediately seek medical attention, correct?
Right. Yeah. Whether you call your pediatrician's office, you call if your insurance carries a nurse on call, giving that call will help direct you to where you need to be seen, how soon you need to be seen, to have a doctor review the full case.
Great. Okay, it's 7:02, so I want to respect everyone's time. We're going to do a lightning round. How about this? Dr. Ophir, Dr. Chitani, you ready for this?
Okay.
We're going to do a couple of questions. I'll try to get to everyone's, but just let's blitz them, okay? How often should we wash fabric masks?
mask, I would wash them every day.
Okay,
Just do them
every
every
day. What about going to the dentist?
Going to the dentist.
Um,
It
I-
depends on what they're doing
yeah.
to be safe.
Yeah.
Yes, go to the dentist.
Go to the
Yeah,
dentist.
I
Make
think
sure that they're being safe.
Yeah, I think it's like everything else. Just do your homework. Ask what are you doing to be able to keep it safe. So make sure that they don't have 10 patients at the same times or 10 staff members, and that everything is the pump for the drainage and all of that. So just ask questions. Make sure what are the modifications that they have done.
Right. Parents, let's do our work on the front end to ask the questions. That's great. Okay, you spoke about fever. Real quickly, what constitutes fever? Because there's a lot of debate out there.
Oh, yes. So you want above a 38.3 if you're doing it in Celsius, above 100.4 if you're doing it in Fahrenheit. So if it says the F, I think most thermometers you'll read will have your Fahrenheit in F. So 100.4 and above.
Okay.
And you want to see that we're really seeing with COVID much higher. So
Yeah.
you won't have to worry about, oh, is this a fever or not? Is this being considered? Yeah. No.
Yeah.
The MISC and COVID fevers have been very high that we've been seeing in kids. And so they will let you know.
Okay. Good. Isn't it amazing? Our bodies were created to let us know when something's off. So that's good. Okay, a couple more things. We're going to zoom through rash. Kids get rashes all the time. And I've heard, COVID-19 kind of manifest in a rash. Are there anything to look for to be able to distinguish the two?
Not really. Actually, there's not a specific rash to the COVID-19. And I think that we as pediatrician or infectious disease specialist, we kind of have to look at the whole picture. If a child has a rash with other symptoms or signs, so if there's a rash with fever and diarrhea and abnormal labs, then we definitely are concerned about COVID. But other than the chilblain of the toes, that have been pointed out, but otherwise it's not a specific rash to COVID-19. So you have to look at the whole picture.
Yeah, that's good. That's good. Okay, last one. We got a couple questions about school, which we're going to continue in this series. It's called Summer to School because we really want to equip parents in this transition into summer and then the transition into school that we have over the next 3 months. So every other Thursday, we're going to be gathering different topics. So as we get closer to August, we're going to focus more on the school subject. So I don't want to dive in it too much right now. I don't know if you want to speak to it, but do you recommend, should parents start looking into homeschool options, or do you think we're going to be in a place where it's going to be safe to send our kids to school?
So I think, again, the parents have to do their homework and address in the school where their children will be going what is being done. I think that, there is going to be, for example, a nurse on site so that in case there is someone who is sick to be evaluated, to be able to do testing, for example, you need to ask about that. How many kids are going to be per classroom, for example? How are they going to manage the mealtime on site? Are they going to do furlough and, for example, keep certain children 1 week on site and then alternate with virtual schooling? So I think that, it is important to be able to address all the issues before sending them, asking the schools how they're going to be able to handle a new format of the school ahead of time. A lot of homework, definitely.
Definitely. It was reassuring, and everybody can go onto this website, the FCAAP website, which stands for the Florida Chapter of the American Academy of Pediatrics. They've been having a web series, and their web series, you will be able to see just today, there was Scott Rivkees, our state surgeon general, who was very reassuring to me to hear of what my children are going to be going into with the public school system. He gave a lot of good points of the plans of what they're going to do. So I encourage, you can go on there, watch the webinars. The AAP.org also is a great website. And of course, the CDC that we've been talking about all today.
Great. Yeah, there's resources there on the screen. Dr. Chitani and Dr. Ophir, thank you so much for your time tonight. Parents who joined us, thank you for tuning in. We hope that you found this time not only encouraging, but as an opportunity to feel equipped with knowledge and resource to help you navigate this unprecedented time that we're living in. And if there's anything that's certain, some things are uncertain, right? We know that the future, we're just not sure, but we can do our best to be diligent and prepared and educated. And so just thankful for your time tonight so that we can just have meaningful, research-based resources to have. So thank you again to UHealth Jackson Children's Care for coordinating this. If Miami Moms Blog can be a resource to you, we are here for you. I've got the websites right up there. I do want to go ahead and encourage you all to mark your calendars. Again, this series is happening all summer. We're going to be back again on June 25th, Thursday. We're actually going to be meeting at 8 p.m. So just stay tuned. You'll get more information about that. But we're going to be talking next gathering about summer safety in general. So fireworks safety, burn safety, swim safety. Again, we're going to have the experts here to answer your questions. But thank you all for joining us. Again, Dr. Afir, Dr. Chitani, thank you for your time. We appreciate you so much.
Thank you for having us.
Thank you for having us.
Everyone have a wonderful, wonderful rest of your week.
Thank you so much. You too.